This is the BetaLife show, brought to you by Better Care Limited. This is a place where you can get better health information for you to live a better life. I'm your host, Dr. Olawale Ogunlana, and I want to welcome you once again to another special episode in my space. Okay, guys. How many of you, don't lie, how many of you actually use Google for your symptoms? I know, every one of you. Anytime you have complaint, you will check, you go on Google and start looking for it. If you have any health complaints, you go on Google. Even for some of you, with your doctor friends, like some of my friends that are actually watching this video, you'll be telling us, doctor, please, come and answer, this health complaint that I have. Please, what is the solution to some of these things? Apart from Google, in fact, these are things that actually happen. Anything that will keep you away from going to go and see the doctor in the hospital, a lot of you are very interested in it. And that's exactly what we are going to be talking about today. In fact, according to a research, it is said that most of the complaints, about 7% of all the things that are searched for on Google are health related. As a matter of fact, about 70,000 health complaints are searched for on Google each minute. And I know some of you that are watching this video, you are part of it. Don't lie. Okay, but we are here today to actually find out what are the most Googled symptoms in Nigeria. So stay with me and we'll be right back.
Hey! If you're thinking about seeing or having seamless access to a medical doctor, having a better healthcare service, or even meeting a health specialist, then you are probably wondering, do I need to go through the stress of traffic and spending so much time just to see a doctor? How about the long queues and overcrowded corridors at the hospital? How much money do I have to spend? Well, you don't need to worry, we have got you. With Better Care, you can talk to a highly competent and unbiased medical doctor through video, audio, or chat. Better Care gives you access to professional prescription, drug delivery, lab orders and bookings, unlimited access to specialists, seamless payment methods, secure payment records, and so much more. Our goal is to improve patient engagement, satisfaction, and general well-being by providing secure and safe platform, 24/7 advanced care, affordable pricing, and holistic care. Sign up today. Talking to a medical doctor has never been this easy. Everybody deserves better care.
Alright, so you're welcome back. This is the BetaLife show, and we are actually discussing the most frequently asked questions by Nigerian patients. And the essence of this episode is just to make sure that I can save your time and money instead of you going to go and see a doctor and to be asking some of these questions. Do you understand? So, question number one, and hey, spoiler alert, block the ears of your children. No, because of this question that I want to ask. So do that right now. Okay. So question number one. I know a lot of people will ask that, doctor, can I get pregnant even though I had sex with a condom? A lot of you are on this table. I know all of you. Brother Paul, Sister Nkechi, Brother Charles, and Brother Tokwe, all of you are on this table. But here's the thing. The short answer to that question is yes, because condoms are not ammo tanks, okay? They are made of plastic, and that's rubber actually. They are made of latex. So, and this latex, they are actually breakable. And then there are some of you, because of the way the thing is doing you, you'll be using your teeth to tear condom, and then you tear it and you tear the rubber as well. You see, congratulations to you. You'll be a father and you welcome a child into your life. So yes, it is very possible for you to get pregnant even if you are using a condom. But here are a few things that you should note. Number one, when you are opening the condom, there is the serrated parts of the condom that you should follow to open it. Do not use your teeth. Brother Ogbemudia, do not use your teeth to open condoms. Please, okay? Use your hands and open the serrated parts. And also, depending on, please, I don't know how many times, do not recycle condoms, because this is something that I actually heard though. But please do not recycle condoms. Condoms are made for only one-time use as well. And then depending on the intensity on how you are doing the thing too, you can decide to scatter everything inside that place, and lo and behold, in fact, let me just say this. I will say this. Condoms are not 100% effective. In fact, it is written on the label. If you check the label, it is written there. So I think I've answered that first question, Abi. Let's move on to the next one. Question number two. Doctor, must I have malaria with typhoid? You see this question, this question is a very funny question, because I can tell you that 80% of the patients that I get to see every day will say, doctor, I think I have malaria and typhoid. And you know, the way my body has been doing me, I feel I have malaria and typhoid. Hello? Malaria and typhoid are not brother and sister. Let me just tell you that one right now. And the truth is, yes, you can have malaria and then you can have typhoid on its own. In fact, let me just save this one for you. Most of the symptoms that you people call typhoid is not actually typhoid. All right, so let's go back to it. But malaria and typhoid are two different diseases. They are not even the same. They are not in the same thing. So it is possible for you to have either malaria or you are having typhoid disease. So that question of must you have malaria with typhoid, it doesn't work. So make sure that you go to a hospital, you see a doctor, you run a few tests, and then you find out which of the two that you have. And to find out if you're having a typhoid test, they will take a stool sample and then they'll run some blood tests for you. And the same thing, if it is malaria, they'll run a malaria screening test for you, and you know exactly what's wrong. But the answer to that question right now is no. Malaria and typhoid are two different diseases and they don't necessarily have to coexist. Okay, so the number 3 question that a lot of people ask is, doctor, how can I prevent high blood pressure? Well, the thing is, high blood pressure, one thing we have to know as Africans is that high blood pressure is a thing in black people. It is common, quite common in black people. And from age 50 and above, it is important to know your blood pressure. Here are a few things that you can do to help reduce the risk of having blood pressure. Number 1, having good exercise. Now, you exercise properly and you keep a good fit and body weight. So you ensure that you are not obese by knowing, you do your body mass index so that you know that you are within the right range. Okay? And the next thing that you can do is you lower your salt intake. You can also reduce, improve your intake of, vegetables and fruits, and live a healthy lifestyle. A sedentary lifestyle actually puts you at risk of high blood pressure. What do I mean by a sedentary lifestyle? A sedentary lifestyle is you sit down almost every time. You don't move about, you are not mobile, you don't exercise, you don't take brisk walks, you don't do anything like that. So these are few things that can help you to prevent blood pressure, as well as your diet too. Low salt diet is also very helpful in the prevention of high blood pressure, but we'll talk about that in a much more elaborate way in some coming episodes. And just to add, there are some clubs, some football clubs that you support that you have high blood pressure. So let me just leave that one there.
My name is Dr. Alfred, and I'm a pediatrician. Nowadays, I get to attend to so many children, and it gives me so much joy and fulfillment knowing that I get to take care of my patients.
Adding to the fact that at least 60% of individuals who seek urgent medical attention can get the same quality service at the comfort of their space without hassle or the fear of spending the whole day at the hospital.
Doctors are easily accessible while patients get better care. Sign up to our website at www.bettercare.ng.
Better care.
Revolutionizing doctor-patient relationship.
So question number 4. Question number 4. Actually, this question used to annoy me. Doctor, can agbo cure infertility? Can Eba concussions cure infertility? And I don't know the thing with Nigerians and agbo. Well, maybe because they are locally made, so people get to trust it. But you see the thing, let me be very honest with you as your doctor. When somebody tells you that one single agbo can cure multiple things at once, please run away. That is babanla scam. That is a big scam. That is a huge scam of a lifetime. Okay? So the truth of the matter is that herbal concoctions are untested. They are largely untested. So their cure for infertility is unknown. Their cure for even something as rampant as malaria is unknown. So why would you just all of a sudden take the risk of drinking some of these things that are not well processed? And as such, it can even affect some of your body systems. Case in point, your liver and your kidneys. So would you want to take that risk? Let me even see. Presently, to do a liver transplant, how much is it, Seth? I think it's about 20 million naira. And if it is a kidney transplant, it should be around 13 to 25 million naira, depending on, so many things. But if you are willing to risk it, maybe you can be taking agbo anyhow as you like. All right, so question number 5. And I know a lot of you have this question in your mind. I get to hear it a lot when I'm seeing some patients. They say, doctor, is taking a glass of wine healthy for me? Well, the answer to this thing is plenty. But let me just put it like this. Yes, there are some studies that actually show that taking a glass of wine is helpful for your heart. But then, I need to tell you this again, that one of the causes of heart failure is alcohol intake. Okay? So you see the issue. You see where the problem is. You see where the problem is. So I don't know how you are going to balance it. And most of you, let's be very, we have to be very honest with ourselves. When a doctor tells you can take a glass of wine, you end up taking 4 glasses. You end up taking half a bottle. Some of you will even finish a bottle. You understand how this thing is. So, I don't know. My own advice to you is that you should try as much as possible, if it is possible, to stay away from alcohol. However, even if you don't want to, there is a limit, and it's just a glass of wine in a day. And lastly, if I tell you to take a glass of wine, I didn't tell you to go and look for a jug or a keg. Please use the wine glass. Use a glass, a shot. Please, at the take of, thank you. Please. All right, so the next question is, the 6th question that I see that a lot of people get to ask is, doctor, how does drugs affect my liver? So here's the thing that you need to know, as a person. Now, the liver itself is a very big organ and it does a lot of functions. But one of the most important functions of the liver is, processing and breaking down of toxic substances. Now, maybe some of us don't understand, but the thing is that drugs are actually poisons, although they come in very low doses to execute a therapeutic effect, that is a treatment effect for a particular reason. But when they are taken out of context, they become poisons. So putting that in mind, it is important to know that most of the drugs that you take are metabolized, that is, they are broken down by your liver. So it is very important that whenever you are taking drugs, you have to be very conscious of what you are taking it in the right dosage, in the right proportion, and not overdosing. One of the few drugs that people overdose on is opioid analgesics, like drugs like tramadol. So that is why you have to be very careful, because abusing drugs can actually damage your liver. And remember, I said it some questions back that liver is about 25 million. That's about $200,000. So if you have the money, fine, okay. But if you don't have the money, please do the right thing.
Hey. If you're thinking about seeing or having seamless access to a medical doctor, having a better healthcare service, or even meeting a health specialist, then you are probably wondering, do I need to go through the stress of traffic and spending so much time just to see a doctor? How about the long queues and overcrowded corridors at the hospital? How much money do I have to spend? Well, you don't need to worry, we have got you. With better care, you can talk to a highly competent and unbiased medical doctor through video, audio, or chat. Better Care gives you access to professional prescription, drug delivery, lab orders and bookings, unlimited access to specialists, seamless payment methods, secure payment records, and so much more. Our goal is to improve patient engagement, satisfaction, and general well-being by providing secure and safe platform, 24/7 advanced care, affordable pricing, and holistic care. Sign up today. Talking to a medical doctor has never been this easy. Everybody deserves better care.
The question that I always, get asked in the hospital is, Doctor, how do I practice safe sex? Well, the thing is that, listen to me, Sister Chioma, you have to listen to me properly. Now, before you are going to have sexual intercourse with someone, it is important for you to know if they have any form of sexually transmitted diseases. Now, safe sex is sex that intercourse between two people that there is no transmission of any form of STDs or sexually transmitted disease. So it's important. So to practice safe sex, make sure you use, a form of contraception, condoms. You make sure that there is proper evaluation of both partners before. There is consent. Consent is taken. You take consent before you have sex. And many of these things, but I don't want to talk too much because your children are actually saying, Daddy, why did you block my ear? But we are going to talk about this in a much more, lengthier episode. So next question, please. All right, so the next question, which is question number 8, Abby. Yes, we are question number 8. Now, the question that I get, again, please, I beg you, block your children's ear. Now, the question that I get asked is, Doctor, is it possible for me to have STD even though I did not penetrate or I didn't have penetrative sexual intercourse? The answer to that question is yes, of course. It is very possible. In fact, one of the diseases that you can get, it's actually a sexually transmitted disease, and you can actually get it even though you didn't have penetrative sex, is herpes. Okay, so there are viral diseases that you can actually contact even if you do not have penetrative sexual intercourse. So please, That is why we say practicing safe sex requires you performing necessary evaluations before you even proceed into the other room. So, will you listen to me? Okay, we'll get to know. All right, so question number 9, because I know your children's ears are still blocked, so I'm still going to say it again. I don't know. I just noticed that a lot of you guys have questions that are related to sex. So maybe we'll make an episode on sex, so that you guys can actually learn a few things. But that's by the way. Let's put it by the way. Okay. Now the question that we get to see again on Google and all of those places is it good or is it okay to use petroleum jelly or olive oil as lubricant for sex? See, I don't understand. I don't understand. There are different types of lubricants. Water-based lubricants actually are the ones that are recommended. Why would you use olive oil or Vaseline as a lubricant? Now, that is the reason why your condom has been tearing, Brother Pius. That's exactly the reason why you have been getting pregnant despite the fact that you are using condom. Of course, if you use the wrong lubricant, it will definitely affect the mode of contraception that you are using. And it can even lead to some sort of infections if you are not actually careful. So that's why it's very important, the kind of lubricants you use during sex. I'm not going to talk too much about it, but one thing you need to know is that there are actually lubricants that are meant for sexual intercourse. So try as much as possible to make use of those ones and not, improvising with Vaseline, olive oil, or some people call it anointing oil. Please now, guys, please.
My name is Dr. Alfred, and I'm a pediatrician. Nowadays, I get to attend to so many children, and it gives me so much joy and fulfillment, knowing that I get to take care of my patients.
Adding to the fact that at least 60% of individuals who seek urgent medical attention can get the same quality service at the comfort of their space without hassle or the fear of spending the whole day at the hospital.
Doctors are easily accessible while patients get better care. Sign up to our website at www.bettercare.ng.
Better care.
Revolutionizing doctor-patient relationship.
Nigerians get to ask a lot on Google. So I hope I've helped you to break it down so that you can understand some of these things. And then you can read up on it too, and we can continue these conversations online. But anyway, we've come to the end of today's episode. This episode was brought to you by Better Care Nigeria Limited, and they are a platform that helps to revolutionize doctor and patient's relationships. You can definitely speak to a doctor wherever you are, from the comfort of your home or even from your office if you have any complaints, and you can book an appointment with a doctor online. So make sure you follow them by clicking on any of those or following any of those handles that are displaying on your screen right now. So anyway, we've come to the end of the show. On behalf of me, myself, and I say thank you for watching today's episode. So I'll see you again, same time, same station. Just make sure that you stay safe and do everything that I said you should do, and don't do the one that I said you should not do. All right, so I'll see you next time. Bye-bye.